manifestable. The sound cessation diastolic with normal adult BP around 120/80 mmHg.
Why do you understand, my dear? You're just reading things that I don't even understand it myself. So the blood pressure measure the volume, how the blood flow from the heart to the body and return back to the heart. So a good blood pressure is definitely telling you the patients will have a good pulse, and the patient blood flow, it's kind of is a good, the body will be oxygenated correctly, because when you have a good blood pressure, which is 120/80, but do not let that fool you. My blood pressure could be 110/50. It's normal for me. The blood pressure usually depend on your blood pressure, it's depend on in your norms. So somebody could be 90/60, they're better than me, who is 120/80, because 120/80 may be high for me, but for somebody else it may be normal.
Okay.
So now read the question one more time.
A newly admitted client is diagnosed with portal hypertension.
Portal hypertension. What is portal hypertension? If you highlight it, you must be able to tell me what is portal hypertension. What is it?
I wrote down.
Okay, darling, you gotta know it by heart now. Because when you're in the exam, you're not gonna be able to write it down. You're not gonna be able to read it back. You must understand it. You must be able to tell yourself, this is what is portal hypertension. What is it in your own words?
High pressure in the liver.
What?
Liver's portal vein.
Okay. And portal hypertension is the liver is involved. Is the pressure in the portal vein. And the portal vein is responsible to perfuse the liver. Perfusion. Darling, it's not okay. You spend 2 weeks, you spend 2 weeks you cannot just show up. And then I already study. I don't need to study anymore. Okay. So if you don't study, you don't know your stuff, it's, because you are too busy. Both of nothing don't want to hear that. They don't want to hear you busy, you didn't have time. That's your business. So, you told me you highlight things. What did you learn when you highlight? Read the questions again.
A newly admitted client is diagnosed with portal hypertension.
Now you know portal hypertension in your own word. What is it?
Portal hypertension is pressure in the liver. High pressure in the liver.
High pressure in the liver cause what? What is the liver is responsible for? Tell me what the liver is responsible for.
The liver is responsible for the oxygenation.
Darling, please. Ou pas d'étudier, chérie, pas fait ça. L'autre jour, moi fait ça avec. C'est dernier bagage moi fait avec nous. Nous dit liver li responsible for what? Storing what?
Ammonia.
Et vrai, l'histoire ammonia? I'm gonna stop right there. You gotta study, darling. Pas qu'à faire comme ça. If you ou pas, c'est pas comme faire l'autre jour avec nous là, oui. You didn't study. I'm sorry. I'm not gonna go through. You didn't study. You didn't study. You spent 2 weeks in study. You just come today to do what? Okay. It's not gonna work. If you don't know what the liver does, what? Filtrations. What is the liver is responsible for? The clotting factors. So then do not repeat it. You gotta learn it. Mm-hmm. When you're in the exam, you're on your own. I'm not gonna be there.
Yeah.
Somebody's at the door. You heard the bell?
Yeah.
I think I heard the bell too. Okay, so you gotta study, my love. It's not gonna work. It's not gonna work. I'm not gonna be moving forward when you don't study, because this is thing that we did last week.
Okay.
So tell me what you know. And we take note. Where's your note? What is the responsibility of the liver? Where's your note? Responsibility of the liver. You should know them by heart. What is the responsibility of the liver? Darling, if you don't know, we study. I'm going to leave it. I'm not going to repeat it because we studied it last week.
Yes.
We did.
Okay.
Même que tu vois, même là, get Simone, ou supposé jouer 1 heure de temps, les abdomis sont sacrifices liés, et l'argent ne signé. Comme la dehors, you besoin de nurse. You must find a time, ou must faire sacrifice pour étudier. Pas de wood pas boire.
Okay.
Pas de wood pas boire. Parce que Vinn là, m'a fait review avant, moi pas prendre examen pour c'est pas le prendre. You must, and you must study.
Okay.
You didn't study. So tell me, okay, read the question one more time, and I'm gonna stop it. And it's not a mean. I'm gonna stop it. Read the question one more time. I'm gonna stop it. You need to go back and study. It's not gonna work.
A newly admitted client is diagnosed with portal hypertension. Which
Okay, kiss out what who I like the question now.
admitted
Newly, that's the word. Newly. That means the patient, they know that she had portal hypertension.
Mm-hmm.
He just find out. New admit, new diagnose, he just get informed.
Yes.
So newly admitted, suppose it can be not tattoo, what the bottom lesson is saying. They're talking to you. They want you to see the patient as somebody who don't know anything about, portal hypertension.
Mm-hmm.
So you need to teach them. You need to know what the liver does. If I was you, I would Google liver functions NCLEX. I'm gonna stop it right there. I'm sorry. I have to. Because you told me point blank you didn't study for 2 weeks. If you didn't study for 2 weeks, you're not gonna make any progress. It's not gonna work. Okay, newly diagnosed with portal hypertension. What is the liver store? Is the liver store some glycogen? Yes or no?
Yes.
Okay. Yes, or do you know that? Gotta look. Okay, so. Okay.
Okay.
If the liver store glycogen, who regulate glucose levels?
Key liver function. What liver does?
Did you?
Metabolism.
Minerals, and what else he metabolize? The glucose, and he store mineral.
Fats and protein.
Okay, so and also the liver does filtrations.
Yeah, detoxifies, filters toxins, drugs.
That means we went over this. We know the liver store glucose. When you end the body's in distress, the liver will release the glucose. What glucose does? What glucose does? Provide energy.
Yeah.
Okay? You need energy. The fat store fat. What fat does? Fat keep you warm. It provide energy. If you don't know those things, I'm gonna stop it right there. I don't know, because if that's the way you're gonna go, it's not gonna work.
No, it's not. I had a bad 2 weeks.
You have a bad drugs. You gotta rearrange your life. My life is already arranged. I wear so many hats. You gotta rearrange your life to make it. That's the way it is. That's the way it's gonna be, and you're gonna thank me later.
Okay.
That's the way it is. You're gonna have to rearrange your life, because when you need something in life, you focus, and period. There's no but or if about it. You should never come here today not knowing those, because we went over this. Come on, we did this question. Come on, next question.
A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection. Following the initial assessment, what should be the nurse's first action? Okay, so I'm gonna highlight for this question, transferred back.
What you gonna highlight?
Transferred back.
What do you mean transfer back? Transfer back to what? What transfer back have to? What transfer back have to do? What is the diagnosis, my love? The first thing you need to know what they're talking about. What they're talking about. Do you understand the question?
Lung resection.
Okay, they're doing a segmental lung resection. How many lungs do you have?
2.
Where are your lungs?
There.
Then the lung cavity. Where? How many lungs? You have the right and the left. How many lobes in the left?
There's 2.
Why?
Because
They have 2 lobes in the left lungs. Why? Not 3.
because of the heart.
That's it. The heart occupies the 3rd lobe. So that means when the patient said they're having chest pain, your job is to ask them, where is the chest pain? And if they tell you it's on the left side, your next move is to press down on the diaphragm and release. If the patient still having pain, it's true chest pain. It's not muscles pain. Because when you press in the muscles, build. If it's muscles pain, it's going to keep on going. It's not going to stop.
Mm-hmm.
If it's muscle pain, it's going to stop. If it's chest pain, it's not going to stop. Keep on going. Read the question one more time and I'm going to stop.
A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection.
Okay, a segmental lung resection, they transfer the patient back. Where do you think the patient is coming from?
The OR.
That's a step down. Step down because when you go to the OR, you have to go to the recovery room. From the recovery room, sometimes they put you on step down to the floor. So that means the patient come from a critical to a low critical to a regular floor.
Okay.
So read the question again.
A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection. Following the initial assessment, what should be the nurse's first action? Oh, I'm sorry. 1 second. I'm at the review. I can't talk now. Yeah. Okay. What should be the nurse's first action? A. Administer pain medication. B. Suction excessive tracheobronchial secretion. C. Assist the client to turn, deep breathe, and cough.
Okay, so now what? Okay, you when you underline, and underline words, it's not because to make your book look pretty.
No.
It's you want to know what this means. So when they do a long resections, what do you think happened in the lungs? It's either they remove what?
They remove a lobe.
That's it. It's either they remove a lobe or they do what? They drain a cyst, or it could be more complicated. So now, we're not surgeons, we're not doctors, we don't give a damn, we don't care. So all we care about is to know our responsibility as nurses when they remove these lobes. So we need to know the position. We're going to put the patient after they remove the lobes, after they do lung resections. I mean, they cut part of the lungs. And how many parts the lungs have?
2 on one side.
How many parts?
Oh.
I'm not asking you lobes. How many parts? Put in your notes, you need to study for me. I mean, the lungs have 3 parts, right?
Yeah.
Bronchi, bronchiole, and alveoli. Mm-hmm. So we draw the picture. Did you study them? My love, you're not ready for the exam. You're not going to be ready anytime soon. Nah, absolutely not. Because we draw the picture. You didn't study. You didn't study, my love. What do you want me to tell you? You're not ready. Because you cannot go blind. Mm-hmm. Why you didn't study them? You gotta make.
I did study the picture that we had. I remember.
What picture? This is not only picture. Let me call Debbie one more time, please. Okay. Because Debbie did study. Maybe that's the reason she didn't want to study with you anymore, because she realized you don't study.
Your call has been forwarded to an automatic voice message system. 7.
Yes, her phone is not on.
So if you don't even know how many parts your lungs have, we draw a picture. We draw the picture of the lungs. How you gonna?
I have that in my notes. The picture we drew.
I'm gonna stop here now. You gotta study, my love. And every time I ask you guys to call me on a Tuesday night, you guys always have something you want to change it. That's not the way it goes. I will hold your hand until you pass the exam, but if you're not steady, there's nothing I can do. I'm gonna stop right there because it's not worth it. Because you didn't study. If we cannot move on past this one, because that's the part you need to know for all respiratory system, all respiratory disease. If you don't know this, the basic, how are you gonna answer questions? So when a patient has COPD, what is the disease sitting on? Where? Which part of the lung?
The alveoli.
That's it. It's the alveoli. So because what the alveoli is responsible for?
For the gas exchange.
That's it. Don't be afraid. Gas exchange. So what happened to the COPD patients? They retain what?
Carbon dioxide.
That's it. They retain carbon dioxide. So now, why sometimes we mistaken COPD patients for patients who inhale smoke? Why?
Because their CO2 is high.
That's it. Because both of them have the same problem. They retain CO2. So what do we do for those patients?
We give them oxygen.
You don't give them oxygen. You give them oxygen. How much oxygen you give them? Less than one?
Less than one, not more than two.
Of course. No, not less than one. Less than two. Not more than two. Less than two, which is 1 liter to 1.5. Less than 2, okay? Or 2.
Bless you.
Okay, thank you. And then what else you do? So how do you get rid of the carbon dioxide? You give them what? A paper bag to breathe. Mm-hmm. Breathe in and out. They need to keep the paper bag in their mouth. In and out. So we need to know all of this. Okay. That's the reason COPD cross pathway with smoke inhalation. That's the way. That's in that, routes they meet. Mm-hmm. All right. So now, what do you think? Read the question again, and I'm going to ask you one question.
A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection. Following the initial assessment, what should be the nurse's first action? Administer pain medication.
Darling, what did you hire first? That's what I asked you to do.
Oh, okay.
Underline.
Medical surgical unit.
Mm-hmm. Why medical surgical unit? Okay, if you underline... Somebody just text. When you underline...
Oh, that's steady.
Go ahead. Mm-hmm.
Hello?
I'm Jounen.
Yeah, we started the review. Yeah. I'm at Marie.
Okay, hold on.
Okay, yeah, I just got...
Hello. Hello.
Hi, Marie.
Hi, my love. Do me a favor. I'm good, baby. Do me a favor. Read the same question, and I'm going to ask Debbie 2 questions. And based on that, I'm going to make a decision. Let's go.
Okay, which one?
Hello, ma'am. Debbie.
Yes?
Stop. She's going to read it.
Okay.
The first page. You have your book with you?
Yes, I'm going upstairs now. Can you give me 1 minute?
No, listen to the question first.
Okay.
Can you listen to the question first?
Yes.
Okay, go ahead.
A client has been transferred back to the medical surgical unit after undergoing a segmental lung resection. Following the initial assessment, what should be the nurse's first action?
What do you underline, Debbie?
The lung resection.
And what else? What else?
Oh. Yes. What should the nurse do first?
First, you see what she did? She underlined long sections because she need to know what she's dealing with. Long section is the key words that will guide you. And then next, you want to know what else they're asking for. What else? What should you do first? First, third, and second and third. That's your priority because they're giving you a message. Let's go.
A. Administer pain medication. B. Suction excessive tracheobronchial secretions. C. Assist client to turn, deep breathe, and cough. D. Monitor oxygen saturation.
What's your answer, Debbie?
Suction.
That's it. Because it's the lungs. You have to keep the lungs spitting. Remember, they just did surgery. Resection, they go inside the lungs with a foreign body, with a knife, with a scissor, whatever, with a poignard. The lungs said, wait a minute, why are you cutting me? The lung will produce more secretions because the lungs is in pain. The lungs is crying. So because of the lungs producing more secretion, I need to be aware that I need to be there to suction the patient so I don't have the patient don't fall back to pneumonia now because accumulations of fluids, accumulations of phlegm will lead the patient to pneumonia. I don't know, Debbie, how you been studying?
Debbie, are you there?
Yes, I'm here.
Next question.
Okay, number 4. What playroom activities would be most appropriate for the nurse to plan for a small group of hospitalized 7-year-old children?
Okay, so what do you underline, please?
Playroom.
That's it. Because, and what else you will underline? Do not underline it, my dear. You don't understand it. What else do you underline, Debbie?
Most appropriate.
And what else?
A small group of hospitalized 7.
No, just the 7-year-old. Because you want the age. You want to apply the Erickson category. Because 7 years old, is it preschooler or school age? What is it?
School age.
Is it school age? That means if it's school age, now read the question again.
What playroom activities would be most appropriate for the nurse to plan for a small group of hospitalized 7-year-old children?
So, darling, the way you read your questions, you read it too fast. Read the question again.
Okay. What playroom activities would be most appropriate for the nurse to plan for a small group of hospitalized 7-year-old children?
A.
Sports and games with rules. B. Finger paints and water play. C. Dress-up clothes and props. D. Chess and television programs.
School age. Now you need to know school age, what age to what age, and you need to know, what is school age? Is it autonomy versus, what is the school age? I know toddler is autonomy versus shame and doubt. What is it for school age? I'm done. Because you didn't get a blood age. I'm done. Now, go steady, darling. It's not going to work.
I'm here.
Okay, what is your answer then?
I went with A.
What is A?
Sports and games with rules.
Go back and check the answer for me, please. That means if Tout ça, Debbie a fait là, c'est réponse, Debbie pas répondre à l'examen.
That's a question.
Darling, look at your answer. You don't even know. You don't even know where to look for your answers.
No, I do.
Okay. Après, 12 ans encore, chérie. Al travail, 6 jours. Cherchez réponse. Ou à occuper Timon, c'est vrai. Timon, ça, il y a docteur, il y a ingénieur, il y a avocat. Yo, même de métier qui a 12 ans de vie. A kembe vie exam nursing mon amour, les ou vin pour ou même l'on nursing mon non car l'on vie bois ou caché dans tête, tu parce qu'ils sont nursery. Ou quand même quitter nursing mon na bâton al travail. Et grand monde si.
Yeah, it is a sports and games.
That's it. Parce que kounya là, you need to know, t'as bien ça m'a dit. Now you need to know all the game. Darling, do not write it.
No, I'm not ready.
So, puisque on connaît school et c'est sport and game, you need to know all the game parce que nous avons l'autre question, c'est la même réponse à la pied. Do you understand?
Yes.
Okay, so c'est quoi ça va étudier? Chérie, I don't know what you've been doing. I don't know how you study, but that's not the correct one. Whatever you're doing, Debbie got it. Read. Okay, go back. Let me have the book. Nous allons la question. Ok, lis question ça.
Which number?
M'bap djou number, m'a montre li parce que m'ka gade côté des billets parce que m'pa des billets. Ouais, qui question montre?
Yeah.
Ok, lis question et puis des billets en avant. Tout le monde en avant. Lis question moi s'il vous plaît.
Which client condition is identifiable if identified during assessment would make the use of benzotropine cogentin contraindicated?
Read the question one more time.
Which client condition, if identified during assessment, would make the benzotropine cogentin contraindicated? Which client condition, if identified during assessment...
Leave this question because it's medication we didn't do it yet. Go to the next one.
Okay. While caring for a newly delivered woman with HIV/AIDS, a student asked nurse how AIDS is diagnosed.
Darling, you gotta know what to read.
Okay, let me start over. While caring...
Let me read it for you guys. Give me. Okay, so now, while caring for a newly delivering woman with HIV, which is AIDS, a student asked the nurse how AIDS is diagnosed. Aside from a positive HIV test, how should the nurse respond? I'm going to read it one more time. While caring for a newly delivering woman with HIV, which is AIDS, a student asked the nurse how AIDS is diagnosed. Aside from a positive HIV test, how should the nurse respond? A. First of all, what you're going to underline here. What you going to underline? Debbie, what you going to underline?
HIV, patient.
What patient? You're a patient yourself right there. What do you mean? What patient? Let me read it one more time.
Okay.
While caring for a newly delivering woman with HIV/AIDS, a student asked the nurse how AIDS is diagnosed aside from a positive HIV test. How should the nurse respond? What do you think they're looking for in that questions? What they're looking for, my dear?
Education.
What they're looking for, Debbie? What they're looking for? Debbie, what they're looking for?
It's a newly diagnosed.
What they're looking for, my dear, in your own words?
How to assess the...
What they're looking for with your own words? While caring for newly delivering women with HIV/AIDS, a student asked the nurse how AIDS is diagnosed. Aside from a positive HIV test, how should the nurse respond?
Oh, okay. They're looking for how HIV is diagnosed.
That's it. That's all you need to know. Now you better know. The complaints of at least 3 months finding. B, the absence of any opportunistic infections. C, CD4 lymphocyte count is less than 200. D, developmental delay in children. What would be your answer?
C.
What is C?
The lymphocytes are low.
So if the lymphocyte, if it's C, what is the normal lymphocyte in a normal person without HIV? The CD4 count supposed to be, if it's lower than 500, it's AIDS. What is the normal CD4 count for someone who don't have HIV? Supposed to be what? 750 and up?
Yes.
So based on that, if you know it, answer the question.
CD4 lymphocyte count is less than 200.
Darling, I'm asking you what is the normal CD4 in a normal person and normal CD4 in somebody with HIV. We went over this. Darling, I'm not guessing. I'm going to leave it right there.